Thank you very much, Chairman, for your kind introduction. So the title is up here, which is Attitude of Patients Towards Use of Chinese Medicine for Prevention of Miscarriages. So as we know, miscarriages are very common. Less than 30 years old, you anticipate about 15%, and more than 40 years old, you anticipate more than half. And what exactly happened we're now facing is, because we have an increasing number of women who choose to bear a child at older age, inverted comma, so then we're going to see more miscarriages. In terms of Western medicine perspective, what treatment are available during the process of threatened miscarriage, which is most commonly vaginal bleeding complicating early pregnancy? You can say no. A lot of people try progesterone, HCG with limited success. And given the fact that probably more than half, especially in the older age women, the cause of miscarriage are chromosomal abnormality. So no matter what you do, it's probably not going to change the outcome very much. So it gives a lot of psychological stress, both to the patients and also to the doctors. Because most of the time the doctors can only tell the patients there's not much you can do. Especially after one miscarriage, when the woman asks you, how can I avoid this happen again? This is a paper published last year in BJOG looking at potentially modifiable risk factors, both before or during pregnancy. So you can see the potential modifiable factors before pregnancy is age less than 30 at conception. Obviously, you can't tell a woman at 33 years of age asking her to go back to 30 years old to have a baby. Underweight, obesity, this is something we can change a little bit. During pregnancy, alcohol, lifting, and night work has been shown to be maybe a modifiable risk factors for preventing miscarriages. Now this is a paper I published about more than 10 years ago, looking at using Chinese medicine during pregnancy. And in this research, we show that there is in fact a lot of misconception. There's a lot of false sense of security of pregnant women using Chinese medicine during pregnancy. They choose to use Chinese medicine because they think Western medicine is more powerful and maybe more harmful to the fetus. So they choose to see Chinese medicine practitioner when they have some common GI or upper respiratory tract symptoms. So in this survey, we distributed a self-administered questionnaire to subjects who are attending a fertility talk. And we asked about the demographic characteristics. We also asked about the history of using herbal Chinese medicine and or acupuncture with the intention to prevent future miscarriages. Okay, not during the acute phase of vaginal bleeding complicating pregnancy, but with the intention to prevent miscarriages. So for all subjects, we asked two specific questions. Do you think herbal Chinese medicine can prevent miscarriage? And do you think acupuncture can do the same? And they can answer yes, no, or don't know. We got a 66% response rate, 208 subjects. Majority were female. And in these subjects, about 20% or 28 actually had miscarriages before. And out of these 28, in fact, almost half of them have used herbal Chinese medicine with the intention to prevent future miscarriage, and 10% use acupuncture. If you look at those without a history of miscarriage, 6% will still use herbal Chinese medicine with the intention to prevent if they would have miscarriage when they get pregnant. And the duration of treatment is about 2 to 48 months. So question 1, herbal Chinese medicine can prevent miscarriages. Half of them say yes. And 5% say no, and 1/3 say don't know. If you look at the same question for acupuncture, 1/3 say yes, about 10% say no, and half say don't know. So you can see herbal Chinese medicine has a stronger belief in women's mind compared to acupuncture. If you look at the characteristics among those who say yes or no or don't know, there's significantly different in ages. Those who say yes to Chinese medicine can prevent miscarriages, on average age about 35, compared to who they say no is the age about 30. And if you use acupuncture, it's pretty much the same distribution. 35 of them say, 35 years old, average say yes, and 30 years old say no. There is no difference in other demographic characteristics, including income, education, country of birth, and occupation. So let's look at whether there is any evidence of Chinese medicine in the process of threatened miscarriage. In fact, most studies available in the literature has no control arm or no placebo. So even during the acute phase of fetal miscarriage, we have no evidence or inconclusive evidence to say Chinese medicine will work. And in terms of prevention, in fact, there is no data in the literature. As clinicians or whoever are going to look after the woman during the phase of fetal miscarriage or immediately after the miscarriage when they are embarking on future pregnancy, we need to be aware of this attitude of, because the woman will not able to get an answer from you as who will be, what measures will be available to prevent future miscarriage. So what happens is when there is actually nothing that the Western medicine practice can do very much, a lot of women will go and embark on using what we call complementary alternative therapy or Chinese medicine, which is very common in our community. And it is our duty to provide an evidence-based advice to this woman. The initiation of doing such study is because of the previous study of using Chinese medicine during pregnancy, and we in fact find pretty much the same in this current study. Thank you very much.
Thank you, Dr. Chen. Any questions from the floor? Okay, if there are no questions from the floor, can we thank the speaker, Ms. Jumana?
Thank you very much.